Compared to other operations, laser eye surgery is relatively safe. But like any surgery, it comes with potential risks, side effects and complications. The College of Optometrists guidelines say patients should be told about these. But during our visits to Optical Express clinics, the risks were often downplayed.
In terms of the treatment, is there anything to the actual treatment, anything to worry about? Or?
Not at all.
Is there anything that I should be worried about really in terms of procedure?
That's all. There's nothing to worry about.
It's the safe, there's nothing to worry about.
Nothing at all. And it's all the laser that's doing it as well.
To say that there's nothing to worry about at all, nothing at all, is frankly misleading. And obviously it's a surgical procedure and patients need to know that there will be small elements of risk attached to that. And then to go on to say that it's the laser that's doing it all and that's why we don't have to worry about it at all is also quite wrong.
Optical Express say discussing the risks of surgery with patients is not an exact science. As well as the consultations, patients are required to sign a detailed consent form on the day of surgery. Well before that, they receive a document in which all risks are described in easy-to-understand language. But at this clinic, at least, any potential danger was dismissed.
It is 100% safe, yes.
Well, certainly it's very misleading to say that it's 100% safe. I mean, that's factually incorrect. There's no surgical procedure that I'm aware of that's 100% safe.
Not only did they underplay the risks involved in 9 out of 10 of our consultations, according to our experts, they overhyped the benefits too.
You get better vision than you would with glasses or contact lenses. Laser is more accurate in terms of what we can correct in terms of your prescription.
Very rarely do patients achieve even better levels of vision after they've had the treatment than they enjoyed with spectacles or contact lenses beforehand. And the simple reason is that while all the measurements are very, very precise, we cannot tell exactly how the patients are going to heal afterwards. And there will be significant differences from one patient to another.
Here's like the one appointment and then your sight's cured.
Well, I would never personally advise someone that their sight will be cured. First of all, they may need spectacles for distance, for driving, for television. You can't guarantee that they won't. And most patients, if not all, will need reading spectacles from their mid-40s onwards.
Providing misleading or false information is not only of concern from a consumer regulations perspective. When making a decision to have a medical procedure, the implications could be far more serious.
One of the most important elements of informed consent is that the patients are given the information about the risks and the benefits of the proposed treatment. Now, if that information, either the risks or the benefits, are false or even misleading, then they haven't been given the appropriate information. And so that undermines the whole process of consent.
When do you see the surgeon?
On the day of procedure.
But concerns aren't limited to the information people receive at Optical Express clinics. The Royal College of Ophthalmologists standards state that all patients should have an appointment with a refractive surgeon prior to the day of the operation. But in 7 out of 10 of our consultations, our researchers were told that they could not meet the surgeon until the actual surgery day.
So I meet him on a day, I can't meet him before or anything?
No, he does everything on the day.
Well, certainly it's very problematic if the surgeon doesn't see the patient until the very day of surgery, which you could define as being the last minute. Obviously, leaving things to the last minute in any event in a surgical procedure is not ideal.
And sometimes the results of those earlier tests can be wrong, as Optical Express patient Gail Burton found out earlier this year.
I was introduced to the consultant surgeon who recommended that I be given a different procedure to the one that I was advised to have. When I asked what the additional cost would be, I was informed that it was going to be £300 per eye.
Gail went ahead with the surgery and Optical Express later agreed to pay the difference. Although she was satisfied with the treatment and the aftercare, she's still unhappy that her medical procedure changed at the last minute, all because she didn't see the surgeon earlier.
I had about between 30 and 45 minutes to make a decision. To be put under so much pressure in a very, very short period of time was very distressing.
Optical Express say cases like Gail's are rare and that surgeons meeting patients beforehand makes no difference to clinical outcomes. They say their standards exceed those of the Royal College, which are only voluntary. Meanwhile, how does the Royal College itself view Optical Express and the way it deals with its customers?
David, you've seen all the evidence from our undercover filming now. What are your main concerns?
Well, I'm very concerned, really. Patients are given to believe that the surgery is almost perfect. Risks are mentioned only in passing and generally if the patient has actually raised the question in the first place. So it's all on the up. It's all overhyping, I would say, the actual results. One of the researchers was told that he really ought to have it done by a certain time in case his prescription increased.
If your prescription changed and keeps getting higher, it could get to the point where you're actually can't have treatment done.
Now that's an absolute no-no. First of all, this gentleman was, I believe, around the 40 age mark, and at that point in time it would be highly unusual for somebody who was only minus 4.5 to go on to have a higher prescription in the coming years. If you believe that the patient's prescription is still changing, then you shouldn't treat them in any case.
You can find the full company response to this item at the bottom of the written web report. If you have any difficulties reading the text, please visit www.bbc.co.uk/accessibility.